Lisa is our rehab director. And for those of you who haven't seen our place, we have a really large rehab space. We kind of expanded. And universally, we get some great comments. We have some fantastic rehab specialists in our center. Lisa is definitely one of them. Has worked really hard to do that. She's an occupational therapist, and she's chosen to talk about apathy, which is a really major issue in Huntington's disease. And so I'm looking forward to this, and I'll turn it over to you.
Thank you, Dr. McFarland. My name is Lisa Warren. I am an occupational therapist. I've been an OT for about 37 years. I've been on the team here at the University of Florida for a little more than 15 years. And so today I've decided to tackle the difficult topic of apathy because it is something that we get asked about so frequently. Um, in our clinic. And so I wanted to present to you, I want to talk about a little bit about the research that's out there in apathy, which is minimal. A little bit about the treatments, also minimal, and then maybe some of the strategies, the real life strategies that hopefully you will find beneficial. So we'll get started. Here's the scientific definition. Of apathy, a quantitative reduction of goal-directed activity in comparison to the patient, to the person's previous level in multiple dimensions, including behavior, cognition, emotion, and social interaction. Those are a whole lot of words. I'm going to tell you how we talk about it in clinic and in real life. The more common way we look at it is a lack of motivation to plan, to organize, or to sustain attention on something. It's indifference. It's a feeling, not a feeling of one way or the other, just indifference about a task or an activity. Impaired generation of thoughts, decreased goal-directed behavior that negatively impacts quality of life. It leads to decreased participation in meaningful or previously meaningful activities. So let's dive in a little bit farther. It is one of the most prevalent neurobehavioral symptoms in Huntington's. And it can happen across the disease process. And I think this is really important. I've listed a couple of the more recent studies that have looked at apathy. And what they found is that apathy can begin before other symptoms of Huntington's begin. So before there are any type of psychiatric or movement type behaviors, with Huntington's, we may start to become more apathetic, a little more disinterested in activity. So it can happen before other symptoms. It certainly can happen along with the beginning of other symptoms. And then we can also see it in advanced disease. So what that means is it can be with us the entire time. It can start before, it can start early, it can start later, but it can be there the entire time. This next statement I think is super important for caregivers and friends and families to understand that apathy is not a volitional or oppositional behavior. It's not a choosing, I'm choosing not to do it. It really is a lack of goal-directed behavior, a decreased ability to see what the long-term implications might be of not participating in that task, and or just indifference. And it often we hear caregivers or families who are frustrated with this, and it is a very frustrating thing to live with if you have Huntington's and if you're the caregiver. But so often I just want her to care. I just want him to care about this again. And it's really challenging because if we're losing that insight, that ability to recognize what our lack of participation means in the long term, it's hard to really want to do that activity. And it affects more than 70% of folks with Huntington. So you're not alone. The majority of people with Huntington's, as well as many other diagnoses, have apathy. It is a burden. Behavioral and psychiatric symptoms are often the most burdensome of all of the symptoms for those with Huntington's and the families. Recent studies show that apathy to be associated with a more rapid decline in function. So I think if you think about this just in our daily lives, this seems pretty logical to me. If apathy is a decrease in doing stuff and doing anything, then I think it seems logical that we would also at the same time have a decline in function. If I'm not doing anything, I'm going to have an overall decline in function. We know with healthy folks that the less we do, the weaker we get over time. We become deconditioned, and then that sets us up for a lot of other issues. So it is very logical that apathy would lead to a more rapid decline. The less you do, probably the worse things will get over time. Symptoms may not be evident to the person with Huntington's themselves, but may be very stressful for family and caregivers. As in the example I was giving you, with sometimes families get frustrated or just have this sense of loss when their loved one with Huntington's isn't showing the interest or the care that they used to. And this often is centered around that person's own self-care, the person with Huntington's losing that ability to have an interest in participating in their own self-care. Apathy is linked to social withdrawal, decreased social satisfaction, and worsening quality of life. This last one I found very interesting, and it is from one of the studies that is listed on the previous slide. So, folks with Huntington's that were interviewed stated that more often than not, they weren't comfortable in situations with unfamiliar people or unfamiliar situations. But yet they were dissatisfied with how their social life was, which seems like it seems to contradict. But I think that maybe that discomfort with new situations is really one set of concerns, and then social satisfaction. Maybe they're wanting more time or more social engagement with familiar things that are familiar to them, perhaps comforting situations. I think that needs to be looked into a little bit more, but I think that we could put some logic to that as to why they're feeling that. I stole this slide from Dr. McFarland's talk because I thought it was really good to show the many components of Huntington's and what everyone is trying to manage and deal with. But one of the most common of those psychiatric behavioral issues is apathy. But apathy can cause us to disengage in cognitive activities and motor movement and physical activities. And so they all go together. They all go hand in hand and are all very, very important. Treatment. So here's the unfortunate part. It is one of the most common behavioral manifestations of Huntington's, yet it's very, very difficult to treat. Unfortunately, effective medical treatments for apathy and cognitive changes are really lacking. So what do we do? What do we do about it? Fighting apathy. How are we going to manage this? Because we know that it is burdensome to those of you with Huntington's and also those of you caring for folks with Huntington's. So, research has shown that any type of intervention that incorporates multiple systems seems to be more helpful. So, motor symptoms, which would be the movement activities, the physical activities, cognitive symptoms, something that address cognition, thinking skills, something that requires some thinking skills, as well as addressing that apathy, may improve functional status. So it isn't just having this tunnel vision or this narrow focus on apathy. It has to include multiple other areas to actually be beneficial. So here are some of the strategies that we work with our patients and families on. Number one, and you will hear this repeated, you will see it in all of the literature, and it is probably one of the most challenging things to implement for all of us. And it is to establish a routine early in the disease process that involves regularly scheduled tasks. It can be helpful if the caregiver is on a similar schedule, and that's certainly helpful for the caregiver. But this establishing a routine early in the process involves a lot of different things. You need to establish routines of activities, of interesting activities. An example, maybe those of you with Huntington's, if you have an interest, let's say in gardening, um, set a schedule so that maybe the plants are watered at 10 o'clock Monday, Wednesday, Friday. That's just an example. Weeding may be done on Saturdays at 4, but whatever time it is or whatever day. Or pruning or planting a particular day, a particular time. That doesn't mean every single task of the day has to be scheduled and we stick to that schedule, but it does mean that meaningful activities, because we want to keep some hobbies, we've got to keep some pleasures in life. We may need to schedule those to make sure that we don't move away from them. Um, the other thing is scheduling hygiene. So this is probably the biggest concern that is brought to the occupational therapist in our clinic from the carers of folks with Huntington's. And we begin with Huntington's, if we become apathetic, we can begin to lose sight of the importance of regular hygiene. One way to think about it is we brush our teeth and we bathe on a regular schedule because we know that it's important. We know that the long-term implications of not doing those, of poor oral hygiene can lead to a lot of health concerns and issues. So we know that we need to do this because the long-term impact can be very negative. So we brush our teeth on a regular basis, or we bathe on a regular basis because that's important in order to be accepted socially, those types of things. When you become apathetic, uh, having the insight for the long-term implications becomes a little more complicated. It is difficult to have a goal-directed behavior that doesn't necessarily provide some immediate satisfaction. You're hungry, you go eat, you satisfy that. You're sleepy, you sleep, you satisfy that. Your stomach hurts, you go to the bathroom, you satisfy that. But there isn't necessarily an urge to go shower or to brush your teeth and an immediate satisfaction. So that becomes really challenging for caregivers who might be a little more unfamiliar with the impacts of apathy. But if you can establish early on that we are the caregiver and the person with Huntington's, we're going to brush our teeth at 8 a.m. and 8 p.m. And that is what is done every single day, 8 a.m. and 8 p.m. And to the best of your ability, try to stick to that schedule so that those things become more of a habit and less of a decision. Apathy with any diagnosis, um, well, if you give folks a choice, do you want to go do this or not? When you're apathetic, you're indifferent, so no, you just want to not do it. So establishing a schedule early that hopefully becomes a habit as the disease progresses, then maybe we don't drift from those activities that really are important. And so it's having those activities that are hobbies and pleasures, but also some of those really, really basic hygiene, self-care tasks that can start to drift from our levels of importance. So starting those routines early, 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 and then trying to stick with it. Super hard to do, hard for all of us, but really important as the disease progresses. The next thing on here is engage in enjoyable activities. I mentioned, try not to let all those pleasures from a life leave us. So if it's gardening or whatever that dancing, whatever that activity might be, let's try to keep those activities in our lives by perhaps scheduling them once a month, once a week, every day, whatever works into your personal routine, whatever you're able to do. And then trying some new activities. That's good for our brains. It's very cognitively stimulating to try something a little bit unfamiliar. Safety always first, but trying some new activities is really important for all of us. Day programs. Alana was on here earlier from social work, and social workers are really good at identifying some local programs that might be appropriate for persons with Huntington's. These day programs can offer cognitive stimulation, thinking stimulation, socialization around other people, and a routine. These day programs are doing something at 8 o'clock, at 8:15, at 8:30, at 8:45. Things are very routine and scheduled, which is super, super helpful to address apathy. And then recruit friends and families to take turns with activities because it's exhausting. It gets exhausting scheduling everything and making sure you're sticking to that schedule. So having some psychosocial support from friends and family is of utmost importance. So it takes a team. Seek help from multiple disciplines, family, friends to address the many, many facets of Huntington's. As an occupational therapist, I put a little blurb in here that occupational therapy intervention focuses on creating and facilitating opportunities to engage in occupations that lead to participation in desired life situations. Occupations here is just talking about what occupies your time. So it's anything that you do during the day or night. And so your occupational therapists are there to help you figure out how to participate in what is meaningful to you and what you should be and what you need to be participating, what you choose to be participating in during the day and night. So fighting apathy, we talked about in an earlier slide how it should involve thinking skills, social skills, movement skills, some physical activity. Establishing a safe and doable exercise routine can be very helpful, and it doesn't have to be anything extensive. Walking is really good. Chair aerobics or regular aerobics, yoga, chair yoga, active exercise. There are many, many ways to get exercise. A physical therapist can help with this, establish an exercise program that is specific to your needs, but also to your abilities and understanding your inabilities, your difficulties, your symptoms, so they can help tailor a program that's going to help you stay active, hopefully have some exercise, but safe exercise. Daily brain exercises and stimulation. There are a lot of different things that can be done. This slide is from one of our speech language pathologists, and these are some of the things that they recommend. So if you haven't in the past played cards, maybe that's one of those new activities that you try. So playing cards or a board game, maybe our Sunday afternoons at 3 are family time for a board game or for a card game, something like that. So this is a list of just different activities that stimulate our brain. Following a recipe, cooking it requires a lot of multitasking. It requires sequencing, timing. It requires a lot of cognitive components. So participating in cooking or being a part of cooking a meal can be really good for us. In conclusion, apathy is a common feature of Huntington's. You're not alone. As I mentioned before, it's a common feature in a lot of other diagnoses too. It's associated with decreased social satisfaction and overall well-being. That makes sense to us. Having a schedule for hygiene early in the disease process is really important. Establish it early, and let's hope it becomes a habit from then on. Having a schedule of activities, so that can be activities of leisure, enjoyment, hobbies. It can be a schedule and should be a schedule of exercise as well, schedules of socialization. Remember all of those components. So having a variety of physical, social, and cognitive thinking stimulation is really our best way to stay active, stay engaged in life, and fight apathy. So thank you for your attention. I hope this has been helpful. We are here to help if you have any questions. Happy to answer them. Thank you.